You're going. You're ready.
Hi, Dr. Weiner, and I'm very proud to present that I'm one of the first to have Restylane Refyne. And Restylane Refyne is Emerville in Europe, but it's recently FDA approved here, and it's renamed Restylane Refyne with a Y, not an I. And there's also Restylane Defyne, which is with a Y as well. So what these products, why are they different? They're different because they have expression technology. Expression technology means when you have expression, it looks better. So it integrates much better than other products into the tissues. So you can't see it when you're having movement. So what I'm going to demonstrate today is Restylane Refyne in the temples and the lower forehead. And the reason why I think that this is a good product for that is because the skin here is very thin. And so you want a product that sort of spreads and fills at the same time. So I think Restylane Refyne is perfect for that. Obviously this is off-label. There's no FDA approved products for this particular area, but it's commonly done. So what we're doing right here is we're numbing the skin with a cool device. It cools you down to approximately 38 to 40 degrees. It's called ARTEK, A-R-T-E-K. And so it's numbing the skin and deeper structures. Right over here, we have a vibration device. And so what the vibration does is it distracts the patient and the brain from any discomfort, and they feel the vibration more than they feel any discomfort. So let's get started here. So I use cannulas for this procedure. I actually use a 23 gauge cannula, which is a larger cannula than you would expect. But the larger cannulas are better because for this area, because there's a lot of vascularity in that area, and the larger cannulas have less chance or risk of entering those vessels. So at first you do a pilot hole. Now I'm doing a pilot hole here, and I do a little vibration with my finger, and it makes a little bit of a hole there in the skin so that I can get the cannula in it. And now, you see the little entry point right there. And now I'm going into the temple. And now my point, the tip is right there. And so the point with doing temples or lower forehead is that you always got to keep moving when you're injecting. So it's a retrograde injection. So here I go, and I'm retrograding injection like that. And you got to do several little injections like that. And then you can go, I'm right now, I'm above the brow, and there's often a little depression above the brow. And this also helps to raise the brow for people that have a little bit of excessive laxity in the upper brow. So I'm just going very smoothly. There's vessels that this is going underneath. And I'm just doing very small aliquots of the Refyne. And so we're filling out the temple. Remember, in females, you want to have a slightly convex temple, males slightly concave. So you want the round appearing temples in females. So I'm almost done with this side. We're not going to put the whole syringe over here. We'll probably do half and half because she doesn't have that much loss of temporal hollowing. So that's half a syringe right there. And you see, you can do it without any bleeding, without any bruising, and it's a very smooth product. And I got half, and I'll do the other side. But remember, use larger cannulas for this area. 23 gauge is probably the best size for this area because you don't interrupt any of the vasculature. It's very safe. It's a retrograde injection, so you go to your farthest point, which is the temporal fusion line, and then you come back. You could actually go a little past the temporal fusion line and come back. You also correct the hollows above the orbital rim. There's a fat pad there that gets diminished with age. And you can actually do it above the orbital rim because that raises the upper lid. Remember that when you do this injection, that you sometimes will numb up the frontal branch of the facial nerve, which comes in right around here and operates the frontalis muscle. So just tell the patient you won't be able to raise your lids, your eyebrows, for the next half hour to 45 minutes until the lidocaine in the product wears off. So that's all you do. That's a temporal injection with the new Refyne, Restylane Refyne. Get it. Thank you.